And for those of you who are already on the webinar, welcome. We do expect to get started on time in about 4 more minutes. Thank you. Oh, also, I have posted some technical information in the chat panel that you might find helpful. Good afternoon, everyone. I'm Leanne Griffin, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Raising the Children of Florida's Opioid Epidemic, Solutions and Support for Grandfamilies. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and to me, I'm the host, by using the Q&A panel. The button to open the panel is usually located on the upper right side of your monitor. So please use the Q&A panel to send any questions you may have as you think of them, and the presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. But if you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel too. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone I will call in option. You must be connected to the audio portion of this presentation and view it on screen to receive a certificate of attendance. The recording and materials used in today's presentation will be available on the FATA website within 5 business days. Also, a PDF version of this PowerPoint presentation will be emailed to participants within that same time frame. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FATA website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FATA as part of registering remains confidential. Statements of credit will be posted within 5 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. And please do note that the evaluation closes at midnight on Monday, December 3rd. 1 to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. If you're certified with the Florida Certification Board or licensed outside the state of Florida, you don't need to provide your certification number when you register with our site. Do be aware that WebEx monitors arrival and departure of attendees and provides us with a report upon completion of the event. We are not permitted to provide contact hours or a certificate of attendance if you do not attend the entire webinar. We are not permitted to provide partial credit. At this time, I'd like to go ahead and introduce our presenters for today. And let's start with Jaia Peterson Lent. Jaia is the Deputy Executive Director at Generations United, where she has worked since 2000. Chris Matthews serves as a Kinship Outreach Coordinator for the Children's Home Network in Pinellas County, Florida. Kenny Stoltman was raised by his grandmother, Chris Matthews. Kenny graduated from high school cum laude and aspires to be a police officer. Diane Woznowski is the Policy and Program Coordinator at Generations United. And I'd like to invite all of our attendees to read our presenters' full biographical summaries on the original Save the Date email everyone received. And we're very pleased to have Jaia, Chris, Kenny, and Diane join us today. And at this time, Jaia, if you're ready, I'm going to bring up your presentation and pass control of the presentation over to you.
Thank you, Leanne. Great. Thank you so much, Leanne, for this opportunity and for holding this presentation on this important topic. First, I'm going to just share a little bit more information about Generations United. Generations United has been around for about 30 years, and we focus on issues that connect the generations. We are home also to the National Center on Grandfamilies, which has been in existence for the last 20 years. And the National Center convenes leaders in the field of grandfamilies or kinship care. We also do advocacy work here in Washington, D.C. on federal issues and track state-level advocacy for the families. We provide resources and information and materials to help grandfamilies across the country, technical assistance and training. And our work is guided by a national network of grandfamily caregivers that represent 42 states and 12 tribes. So we really make sure that everything that we do, whether it be advocacy, resources, or materials, is really driven by the experiences of the families themselves. So that's a little bit about Generations United. The topics that we're going to be covering today, or the objectives that we will be hitting, are threefold. One will be considering the opioid epidemic's impact on children in Florida, as well as kinship caregivers or grandfamilies that step in to care for them. We'll also be discussing the effects of opioid use disorders and other substance use disorders across generations, with a particular focus on the challenges of raising children of a parent that has an opioid use disorder. And then we'll specifically highlight a few key programs that are benefiting grandfamilies in different parts of the country. For my 50th birthday, I got a 2-year-old. This comes from Pamela Livingood, who is a grandparent caregiver that stepped in to raise her grandchild after her grandchild's parent was unable to because of opioids. She joins increasing numbers of grandfamilies across the country that are stepping in to care for their children, their grandchildren, when their parents cannot. When we talk about grandfamilies, another common term for grandfamilies is kinship care. And when we use the term, we're actually inclusive not only of grandparents raising grandchildren, but also of other relatives, and even we include close family friends, which in some circles are referred to as fictive kin, just meaning another important person in a child's life who is familiar to them even before that individual began raising them. We've seen in recent years, particularly since 2012, that there's been an increase in the number of children in the formal foster care system. And as we've seen that increase happen, we've seen a parallel increase happen with the number of grandfamilies across the country, whether they're raising children inside or outside of the formal foster care system. And we'll talk about those differences in a little bit. The good news about grandfamilies is that research is very clear that children do best with relatives when there is a safe and appropriate relative available to care for them. In fact, the research shows that when children are with relatives in foster care compared to being with non-relatives in foster care, they have more permanency, meaning the home that they are in is more likely to be their forever home, their permanent home. There's also research showing that they're safer with relatives, that they have better behavioral and mental health outcomes, and that they're more likely to stay connected to brothers and sisters. So often you have a grandmother who's willing to take the whole sibling group to care for them, versus perhaps being split up in a non-related foster care situation. Or even if children are split between an aunt and a grandmother, for example, that those relatives are going to be naturally coming together for family events, or really make that effort to regularly keep those children connected to their brothers and sisters. We see more stability with grandfamilies, that the children are less likely to be changing schools multiple times or be moving from family to family. We also see issues related to cultural identity, that children in grandfamilies are more likely to be connected to their cultural heritage and identity. I think one really compelling story that speaks to this as I spoke with a woman recently who is Native American, who grew up in foster care. She was actually adopted out of foster care by a white family. And in her young years, she spoke of how she always struggled with an eating disorder, had a lot of challenges with mental health, and particularly around eating issues. And when she became an adult, she had an opportunity to learn more about her heritage and went to visit her tribe. And she said it was transformational when she was able to go and visit with her people, that she looked around and she saw, you know, the other women here have strong, sturdy middles. And she really said, you know, I was struggling with this eating disorder, and it was just, this is who I am. These are how my people are. And I was struggling to look a certain way, but if I had known where I had come from, what my family was, and what my people, who my people were, it would have been such a different experience growing up. So really having that connection to family and cultural identity can have an impact in ways that we just don't even think of at times. And then building on that, a sense of belonging, that we know that research actually shows that children in relative care are more likely to report that they always feel loved. So recognizing that children do best with relatives, how many grandfamilies are there in the country? This image of concentric circles shows what the data tells us. And the data can be a little bit complicated. Our primary data source for Grandfamilies information comes from the U.S. Census Bureau. And the Census Bureau actually does not ask a question to specifically get at how many children are raised by grandparents or other relatives. So we have to do some deduction from the data that we do have. So what we do know is that this largest circle, 7.7 million children, are the number of children who live with a relative who is the head of the household. Now, in these families, there may be a parent present, and that parent may or may not be playing a role in caregiving for the child, but we know that there is a grandparent or another relative other than the child's parent who is recognized as the head of the household. Then the next circle are the number of children who are being raised by a relative or a close family friend and don't have a parent living in the home. So we are very confident that those 2.6 million children are being raised by a grandparent or another relative. They are in a grandfamily where that parent is not playing a caregiving role. The reality of how many grandfamilies there are across the country likely falls somewhere between that 7.7 million and the 2.6 million, because we know that there are a number of grandfamilies where a parent may be there but not playing that primary caregiving role in the life of a child because they face other challenges. And then finally, the smallest of the concentric circles, the 139,000 children, are the number of children that are being raised by a grandparent or another relative inside of the formal child welfare system. So that means that they are essentially foster parents of the children, that the child welfare system has the legal custody of those children, and they are going through, have a similar level of engagement or monitoring by the child welfare system, and in some cases, additional supports and services that come with being part of the formal child welfare system. But it's important to recognize that that smallest concentric circle is really quite small compared to the rest of the population. And that's particularly significant because those outside of the smallest circle are much less likely to have supports and services that they may very well need to be able to provide for the basic needs of the children. So in fact, for every one child that is in foster care with relatives, there are actually 19 children being raised by grandparents or other relatives outside of the formal foster care system, oftentimes on their own without access not only to financial supports and services, but even basic information about where to go to get help. And we'll talk about the full range of types of help that are useful to them in a minute. It's also significant because we know we do have some data from census specifically on grandparents who report they're responsible for grandchildren, and we know that they face a lot of challenges. We know that 57% of them are in the workforce. So while there are many not working, perhaps retired, there are many working. So those that are retired may face challenges because they are living on fixed incomes and we're not planning to raise children in their retirement. Those that are in the workforce may face challenges because suddenly they need to be caring for children, and child care may be an issue, for example. We also know that nearly 1 in 5 of them live below the federal poverty line. And it's always important to recognize that the federal poverty line is very, very low. So there are certainly numbers just above the federal poverty line that if many of us looked at their financial situation, we would probably consider them very low income or poor. But the poorest of the poor, those that live under the poverty line, even about 1 in 5 grandparents fall into that category. We also know that just over a fourth actually have a disability, so they're facing challenges with their own health as they're stepping in to raise their grandchildren. And 43% have been providing care for 5 or more years. So we know that while many times grandfamilies step into this role thinking that it's going to be temporary and that soon the parent will be able to step back in and care for the children when they get things together, that so often it ends up being a long-term arrangement. And again, a long-term arrangement where often they have little support to provide for the needs for this child that they had not planned to raise. And then finally, significant numbers of these grandparents are indeed older. While we certainly have many younger grandparents, 41% are actually over 60 years old, and more likely to be in that third age of their life. So that's a little bit about the grandparents themselves. Focusing in a little bit more on children that are part of the formal foster care or child welfare system. I mentioned earlier that in 2012 we started seeing an uptick in the number of children that are in foster care, and that number has been steadily increasing since then for the last 5 years of data that we have available to us. And while we've been seeing the number of children entering foster care go up, we've also seen child welfare systems increasingly relying on relatives to care for the children that come into foster care. In fact, over about the last decade, we've seen an increase of 9 percentage points from 24% in 2008 all the way up to 33% in 2017. So we now see that about a third of all children that enter foster care are actually in foster care with relatives now. When we hone in a little bit closer on that data and take a look at what it looks like in Florida, about 4% of all children in the state are being raised by grandparents or other relatives or close family friends. And that is actually, while it doesn't say here, that would specifically refer to those situations where no parent of that child is present. And that percentage is pretty consistent with national data across the country. But then when you hone in further to the children that are in foster care being raised in kinship care or in grandfamilies, that number is 44%, which you saw earlier, national average is now about 33% of kids in foster care with relatives. Florida is doing better in that respect, has really clearly made a commitment to prioritizing relatives for children, and the numbers are significantly above the national average. That's 2016 data, which is the most current publicly available data on that issue. Now, why do children come into the care of relatives? In addition to substance use, we see a whole range of different factors that can result in grandfamilies. I have a long list up on the screen here for you. These aren't ranked in any particular order, but just want you to get a sense of the diversity of reasons that it can happen. However, certainly chief among them is the issue of substance use. And we do have specific data that looks at the reasons that children enter the child welfare system and does ask the question about whether or not substance use was a factor in children entering the child welfare system. And national data shows that about 36% of children in foster care are there because of parental substance use, who are there because of parental substance use are with relatives. So we know that in particular, when children come into foster care because of a substance use issue, they are really likely to be placed with relatives. In fact, when we look specifically at family foster care, so we know that when children come into foster care, they could be placed in families, or in some cases they are placed in residential or group care. But when we look at those children that enter foster care and are placed with families, those children are now, when they're placed with families because of a substance use issue, those children are now more likely to be placed with relatives than with non-relatives. And we really see that as a positive thing because of all the reasons we highlighted earlier, how children do better with relatives. And this chart shows particularly how the trends have gone over about the last decade, that for years there were more children placed with non-relatives in family foster care than relatives, but we're seeing those lines intersect as states and localities are prioritizing relatives for children. And again, we see that as a very positive thing, but we also need to simultaneously be providing the support to relatives that they need to ensure they can meet those children's needs and help them thrive. When we hone in more closely on Florida, we see that 52% of children in foster care in Florida because of parental drug and alcohol use are with relatives. So again, the numbers prioritizing relatives is higher in Florida than the national average, and particularly when it comes to the reason being drug or alcohol use. And that's compared to 33% going into foster care with non-relatives. Okay, so a little bit more about substance use and Grandfamilies. We do know from anecdotes and from some localized data that substance use is one of the #1 reasons Grandfamilies come together. But it's important to recognize that this has been happening for decades, from early years where the focus was really on alcohol use to then other drugs. In the 80s and 90s, crack cocaine got a lot of attention, and we saw jumps in the numbers then. Then in the early 2000s, meth, and then most recently, opioids. And the question is, why are we seeing particularly elevated attention to families now because of the opioid crisis? We did a report in 2016 looking at the issue of Grandfamilies resulting from the opioid epidemic, and we just recently updated that report in 2018. And among the many reasons that there's been special attention been paid to the opioid crisis in particular, many have argued that it's the fact that this issue has had a particular impact on rural America, not just urban communities, whereas some of the past epidemics have been more visibly impacting those different parts of the country. We've also seen a very visible impact on white and middle-class families. So many argue that it's getting more attention because of different populations that it's impacting in that way. And then another rather unique piece is the role of prescription medications in the opioid crisis. And in referring to that, I'm talking about some really quite high-profile stories about the aggressive marketing campaigns of certain drug companies to patients without informing them of the impact of these drugs on the brain and the potential for them to lead to addiction. And in addition to that, we have seen an extraordinary number of overdose deaths related to the opioid crisis. In fact, between 2015 and 2016, there was a 29% increase in overdose death rate among adults of childbearing age. So not only are we seeing significant death rates, but particularly it's among adults that are likely to have children, and so those children need a place to go and a place to be raised and cared for. I mentioned that we did our report in 2016 and then updated it in 2018. In addition to the really compelling data related to the overdose death rate that happened since our 2016 report, the other significant finding that we found, really just in the last 2 years where there's been a significant jump, is that it is actually increasingly not just a rural white issue, that we've actually seen a sharp increase among African Americans in urban countries in terms of opioid use and overdose deaths. And we're looking at a 41% increase in 2016. We regularly get calls and questions about how many grand families are formed specifically because of opioids across the country. And the short answer is that we don't know. There is no national data collected specifically on why grand families are formed, and certainly not if it's because of substance use, which drug in particularly led to the forming of a grand family. But we did do a brief survey with a national network of programs that serve grand families. This is the Relatives as Parents program that's supported by a foundation called the Brookdale Foundation. They give small grants to do support groups across the country for these families. And they have a special focus on families that are raising, grand families that are raising children outside of the formal foster care system. So the data that I gave you earlier about how many children are placed with relatives because of substance use, that was really looking at children placed by the child welfare system. But as I mentioned, there are many, many families that never come to the attention of the child welfare system in the first place and raise children outside of the system. And so this particular survey was really focusing primarily on those families outside of the system. And what we found in that survey is that among those that responded from the Relatives as Parents program network, almost all of the programs serve families impacted by parental alcohol and drug use of some kind. And more than 70% of the programs that did report being impacted by parental alcohol and drug use, more than 70% of those programs identified opioids as one of the most common drugs. So while we know there are certain parts of the country that are much more likely to be impacted by opioids than others, what we're seeing is, on the whole, it really is a significant issue that's affecting many, many families and programs serving these families. And so what does that mean in terms of services? We also asked in the survey, well, what do they need when these families are impacted in this way? And in particular, they spoke about the need for kinship navigator services, which I'll talk about more, but those are services that help families connect to what is available in their community, whether it be access to benefits or access to support groups or other community-based services. They also need quality mental health services, and finally, financial assistance and counseling. And those were the top-rated services reported as needed by families impacted by opioids. So, I've talked a lot about the data and some of the specific issues and data in Florida. What we want to do now is have an opportunity for you to hear directly from a family that's been impacted by the opioid crisis. And so now I am delighted and privileged to turn over the microphone to Chris Matthews. And Chris Matthews, I'll say, is a member of Generations United's Grand Voices Network, which I mentioned earlier. We are so delighted that we have this strong network of caregivers across the country who guide and lead our work. And Chris has been with us since nearly the beginning of the creation of our Grand Network. I really value her input and has a really powerful story. So I will turn it over to Chris, and then I understand Chris will introduce Kenny to share his story as well. So Chris.
Hi, everyone. I'm glad to be here today. It's like a few years that my daughter got into using drugs and moved on to the opioid crisis. And how it impacts our families is that, you know, you're going along and everything seems okay. But at the time when all this happened, I had a stroke and 3 heart attacks, and I was recovering from that. And at the same time, trying to help my daughter hang on to her children. And then she got in trouble with the law. And then next thing I know, she can't deal with the house arrest and drops the kids off on my doorstep and leaves the state. Okay, what are you going to do? Well, in Florida, that's not abandonment because she left them in a safe environment. So therefore, I don't know what to do. And I was lucky because when I called the police on that and they came, they informed me about a kinship program, which then helped me out there. But at first you have to realize, when I got the kids, clothes on their back. That's it. No medical records, no Social Security cards, nothing. And you have to get all that. And that's where the kinship program came in, and they helped me get that. But then you got to look at the fact my health wasn't that good, and I was nervous about having them. But it worked out over time. The opioid epidemic, it leaves a mark on the whole family because I was on disability. My partner was still working, but we lived in a 55-plus because we had already decided for our retirement home. And so I had to fight an HOA to stay living here and keep our home. We did win that case, thankfully, and we still live here. But it's the opioids, they come in, and next thing we know, the kids are having issues, and then you're having to take care of that. So you're taking out, you're getting rid of your 401ks. You've got to open them up. So by the time you're done raising those kids, guess what? You're broke, you know, but I don't regret any of that. I loved raising the kids, but the opioid, they affect every part of your life. You know, it's financially, it's your home where you live, it's everything you do. All of a sudden, your friends, you don't have them anymore because they're retired. They don't want kids around. They're doing other activities. So you have to go to support groups and meet other people, and you get a whole new circle of friends. And that is the way your life starts going. And we you know, did go to court with the help of kinship, and we got custody of the kids. It is a little bit of a battle to do that, and frustrating and very stressful. And that's a lot of what your family's going through, is a lot of stress. So we went to support groups, and believe me, they are a godsend. We went every month. We went as often as we could, not just for us, but the kids, because they got to meet other kids that were in the same boat as they were. They were not alone out there, and which a lot of them think they are. And so it's helpful to the whole family. And the stress starts leaving you because you get help in getting things done and find out what's going on. And you see the opioid epidemic, you just see it. Everybody you talk to, it's their daughter, it's their son, you know, and it affects all of us in so many different ways. You know, it's like, I know I sound like I'm advocating a lot here, also being an opioid, because I ended up working for Kinship. I am the outreach coordinator, and it's what I do. I go through the whole county looking for our families and getting them in the program because I know how much it means to us to have that. It is it relieves so much stress in your life. So anyway, I guess my time is just about up. So I'd like to introduce you to my grandson, Kenny Stoltman. He is now 21 and still lives with me. So Kenny, take it over.
Thank you. My situation began back when I was living actually with my mother and father. My father was an alcoholic and a drug addict, and my mother was a bipolar drug addict. My father was always violent and very angry whenever he drank, and inevitably my mother abandoned me to his care and left to Florida to be near my grandmother, and took my sister with her. Not there shortly after, my father almost beat his girlfriend at the time to death, and the state intervened and had me sent down to Florida. Thankfully, my grandmother helped with that because my mother was in no capable means of taking care of me. When I got to Florida, I didn't know what to expect, but it didn't get better. My mother was still very deep into drugs, very deep within bad people. Her boyfriend was just as much an alcoholic as my previous father. And only after being in Florida for about 2-3 months or so, my father actually passed away. He drank himself to death. I was told about this at school. And I didn't know how to cope. A lot was still going on, and my family was only getting worse. The only person who was actually very consistent and helped me through that whole time was my grandmother. She wasn't raising me at the time, but I spent a lot of time living with her. A few years later, eventually, though, after dealing with the police, my mother abandoned me to my grandmother. It was the second time she left me, and that would ultimately be one of the last times I'd see her for many years to come. It devastated me. I didn't know how to handle it at the time. I didn't talk to my grandmother about it, and it led to severe depression on my part, led to anger and resentment, and I didn't know how to deal with any of it, and I was being bullied in school at the time, and I ended up making a terrible mistake. I attempted to take my own life and ended up almost taking somebody else's. I went to juvenile detention, and eventually, with my grandmother's help, who was there for me the entire time, helped me get out of that, helped me rebuild myself and become better than who I was before that happened. And what I know, looking back on it all these years later, is if it had not been for my grandmother, if I had been anywhere else, I very well probably would never have survived that scenario. There's no way I would have come back. She was there the whole way through. Even when I didn't know it, she was still there for me, still fighting for me. And I realized that it was the drugs that did it. They took away my mother. They took away my father. They prevented me from having a family. And I thank God every day that my grandmother was here for me, because without her, I would not have survived that ordeal. I wouldn't have been able to come back any different. And now that's why I do what I do. I talk about it because I want other people not to make the same mistakes I did. And I want to make people aware that it is more than likely better for the child to be with somebody they know, somebody in their family, because I know if I wasn't, I more than likely would not have survived. I wouldn't be here today. I wouldn't be working full-time at Lowe's. I would not have graduated valedictorian from high school. That I wouldn't still be pushing to try and become a police officer to help deal with other drug-related offenses and whatnot. And my inspiration to deal with those things. So thank you.
Thank you so much, Kenny, and thank you, Chris, for sharing really that inspiring story about the role that a grandfamily can play in a young life. And congratulations to you, Kenny, for where you are now and all your success. And we're so honored that you're sharing your story. And Chris, for the role you are playing now as a kinship worker. I wanted to just highlight, I think Chris mentioned the kinship program, but didn't talk about what that program was in particular. I will be sharing a little bit about the Children's Home Network later in this presentation. And Chris does work for the Children's Home Network kinship program. There's also some information about her in her bio. So thank you again to both of you. It's certainly inspiring to hear from you both, and I think that your story so well illustrates the important protective role that grandfamilies can play. And particularly, we really have been hearing more and more in recent years, hopefully, in the child welfare space. Many of you have heard about the particular impact of trauma in the lives of children and how that can impact them into adulthood, particularly if it's not addressed and if there aren't protective factors placed in their lives. We mentioned that we did a 2016 report on the opioid crisis. Our follow-up report after that particularly honed in on the issue of trauma and looked at the ways that grandfamilies raising children who've experienced trauma can really reduce and mitigate the impact of that trauma. So it's hard to talk about trauma without using the phrase ACEs. And for folks that may not be familiar with that, ACEs stands for Adverse Childhood Experiences. And in short, that means that really bad things happened to a child during their childhood. And in many cases, those bad things happened by the very person who was supposed to protect them, or the person who was supposed to protect them was not able to protect them from something really bad happening to them. And so ACEs include things like child abuse and neglect, having a parent who is addicted to drugs or alcohol or has a substance use disorder. And what we know is when those things happen, having a consistent, trusted adult can really have an impact to reduce that trauma. We don't have specific data on ACEs and adverse experiences of children who eventually come to live with grandfamilies. That data is not something that's routinely collected. But what we do have is data that looks at the number of ACEs among children who have come to the attention of the child welfare system. And as I mentioned earlier in this presentation, we often see many parallels between grandfamilies and children in foster care or in the child welfare system. So what the research shows is that if you compare children in child welfare to those who are in the general population, and you look at how many have no ACEs in their history, that in the general child welfare population, there's only 1% of children that report no ACEs. But the general population, 36% have no ACEs at all. What we know about ACEs is when a child has 4 or more, there's something about that number 4 that really has a strong impact on that child. And they're more likely to have trauma that actually leads to really negative health outcomes in adulthood. In fact, they're 12 times more likely to have significant negative health outcomes in adulthood if they've had 4 or more ACEs. And when you look at the child welfare system numbers of 4 or more ACEs, it's actually more than half compared to 13% in the general population. So those coming to the attention of child welfare and those that ultimately go to live with grandfamilies have generally really experienced significant trauma. And this also means not only physical health is impacted in adulthood, but they're more likely to have anxiety, depression, and behavioral problems than those children that are not in foster care. And a piece that I think is really significant about this and perhaps is getting better understood is that trauma can happen. ACEs happening to children at a young age still impacts them. I think, it's easy to hear, well, this happened to that child when they were so young, they probably don't even remember it. Well, what we've learned about how a child's brain or a baby's brain develops is that it really is learning and taking in information so rapidly that those first 5 years and those under 3 years are incredibly important for a child's development. So in fact, when they experience trauma, even in infancy, it does have an impact and needs to be mitigated. And we know that 38% of children under 3 in the child welfare system actually have 4 or more ACEs. So significant numbers experience these traumatic events at a young age. This is one member of our grand network that I think speaks to it so well. She says, I thought because my grandkids were babies when I took them, 6 months, 1.5, 2.5, they were not going to have any problems. Boy, was I wrong. They had problems with separation anxiety. It was so painful to see them go through this. I had to tell them 100 times a day how much I loved them and that I was never going to leave them. That comes from Jaia from Texas. So what else is the impact of ACEs and the impact of children that have traumatic events in their young life that leads them to need to go live with grandfamilies? Well, certainly we see that they have attachment issues, that they may have trouble separating from their caregiver, that they may be clingy or have a hard time, or they may have a hard time actually connecting initially. They have a hard time trusting or feeling comfortable really expressing love or connectedness. So many of that is often related to this sense of abandonment. They are almost always experiencing significant grief and loss issues, whether their parent has died or is no longer in regular connection with them. Whether there's regular visits or not, it's just that it's a different level of connection with that parent. And what you hear again and again from both young people who have lost that connection with their parent and grandfamilies is that, children love their parents and wish that they had that connection. Even if the grandparent or the foster parent is doing a fabulous job, there is a real natural desire to have a strong and connected relationship with a parent. We also see it play out in terms of behavior. I think Kenny spoke to the challenge that he had in his young life as he was struggling with, what he had experienced when living with his parents. I appreciate you sharing that story, and very naturally and consistent with what we know, it resulted in some behavioral issues that you have recovered from in an incredible way, Kenny, but I think that really illustrates the impact of what trauma can have on children and into teenage and adulthood life. And then mental health. We see really strong impacts on mental health and physical health that I spoke to in those earlier diagrams. So what we know is that grandfamilies are stepping in to take care of children that have significant issues. When a traditional foster parent signs up to be a foster parent, before they step into that role, they have significant training on what it's going to mean, and that you may very well be caring for children that will have these significant trauma histories, and how do I prepare for that? But what we know is grandfamilies step into this role so often very unexpectedly. They don't have the opportunity to have all of that pre-service training because the children come to them sometimes in the middle of the night with very little warning. Yet they need that support. We know that children do better with grandfamilies, but they still need supports and services. And this quote speaks to that from Jan Wagner from Michigan, who explains, "One thing I know to be true, you can't love away the effects of trauma from neglect and abuse. We need support to help children heal." And the full piece of that quote that couldn't quite fit on this slide was she was really conveying that kin families, those children and grandfamilies, need the same level of supports and services that traditional non-related foster parents typically get, and kinship families do not always receive. So now I'll talk a bit about some of the challenges specifically that the caregiver faces. We talked already about those issues facing the child. We'll start with talking about issues of grief and loss. When we think about grief and loss for the caregiver, there are all kinds of grieving that's taking place. I think often people think immediately about perhaps the loss of an adult child. If their child has experienced a fatal overdose, they're mourning the loss of that adult child. But in addition to that, perhaps they haven't experienced a fatal overdose, but their life has not turned out the way that that grandparent expected their child's adult life to turn out. So they're grieving the expected life or relationship that they thought they would have with that adult child when they were an adult. The grandparent or other relative may also be grieving the expectation of having a healthy grandchild or relative child if the child has a number of health issues related to what happened to them when they were either in utero or being cared for by that parent who was struggling. They may be grieving the loss of the traditional grandparent role. They were expecting and looking forward to being a grandparent where you give the child cookies when they come over to visit and candy and sugar them up and send them home to mom and dad to take care of the discipline and the other challenges. And now, the child goes to grandma's house and stays, and now they're in the role of the disciplinarian and full-time, which was not the expectation. So we miss out on being granny. And peer friendships. So often we hear from grand families that I don't have the same friends anymore. My friends are off going to the movies, playing golf, doing things with their friends that don't include childcare, and so they lose connections with those friends that they had had. They also could be mourning the loss of what they expected retirement to be like. So in addition to not having those peer connections, the actual things that they are doing are different. They're not doing the traveling, perhaps, that they expected to do. Instead, they're going to every school event and driving to soccer practice or basketball or music lessons or whatever it was that they were not planning to do on a weekly basis with the children. And then finally, they may be mourning the loss of their financial security. If they had been planning for retirement and now they've used that retirement savings to pay for school needs or clothing for the children or food for the children. So that's another significant loss for them. In addition to that, they may be facing other mental health and social challenges. We talked about changing peer friends, but they may also simply feel isolated if they've lost their friends and not yet connected to another support group or other place to make other friendships. They may very well feel isolated, feeling like they're the only one in this situation, which we know is not the case, but can feel that way until they get connected to other supports. They may be feeling stigma or feeling a sense of shame, feeling like perhaps their friends or peers are looking down on them for them being in this situation without understanding the full context and how this can happen to anyone. They may have real concerns, of course, if the child that they're raising, their risk of substance use. If their parent is struggling from a substance use disorder, knowing that child is at a higher risk of having the same experience, and what can they do about that? We also find that kinship or grandfamilies struggle with issues of dual loyalties because on the one hand, their first priority must be to this young child, the grandchild or other relative that they are raising. They need to be prioritizing caring for and protecting that child. But at the same time, they're managing dynamics with birth parents and maybe trying to help that birth parent get the help that they need through treatment or recovery. The parent could be homeless or have some other issues related to their substance use disorder that they're really trying to help out with, and it's an incredible amount to manage. And in addition to managing the dynamics with the child and the birth parent, what I've really found, particularly with our network of grandfamilies across the country, is so often that grandfamily caregiver is not only providing care for the child and helping the birth parent, but they also tend to be the rock of the whole family system. So they're also bringing meals to their aunt up the street and helping their sister out with some issues. So they're not only managing those caregiving issues, but they really are the relied upon individual for so many other things in their family. And in addition to that, they may be getting some feedback from other family members about how they think they should or should not be raising this child or managing this responsibility. And so that is really an incredible amount of pressure on caregivers. Other challenges that they face, their health. We so often find that they are likely to start putting the child's health as a priority, and oftentimes maybe neglecting their own health needs. If they have limited time and they have to decide between going to the health appointment for the child or theirs, they're going to push back their own appointment. So often they just don't have adequate access to supportive services such as respite or child care is a big one that they find, unexpectedly needing child care and not knowing where to go for it. Financial issues are a huge burden that we spoke to. If they've been saving for retirement and now live on a fixed income, where am I going to find the money to raise a child that I wasn't expecting to? Housing issues, I think Chris spoke really eloquently to that. We have many grandfamilies that may be living in senior-only housing, or at least housing that's described that way. It's important to know that public housing that is for seniors actually cannot exclude children by law, but so often relatives don't know that, and they're told that they have to find other housing or that they'll lose their home. So helping finding appropriate housing of adequate size to care for additional children is a huge issue. And then legal issues. As I mentioned, the vast majority of these families are raising children outside of the formal foster care system. So many of them may not actually have legal custody of the children, and that means they may not have authority to enroll the children in school, consent to medical care for the children, or get access to the medical records that they might need to enroll the children in school or camps or other things. And of course, the costs of legal help can be really significant. And we have many, many stories of grandfamilies spending down their retirement savings, spending $20,000 on legal fees, particularly if you have a parent with a mental health issue, for example, who's contesting attempts to get legal custody of the children. Also, one of the number one things that we hear from grandfamilies is, I just simply needed access to information. And I will talk a bit more about kinship navigator services, which is a way that grandfamilies can get access to information about what is available to help them. And then also, in their role, particularly if they don't have legal custody of the children, or sometimes even if they do, we often hear that grandfamilies are left out of treatment plans. So if there's a school meeting for an individualized education plan, for example, so often they're reaching out to the parent but not inclusive of grandparents. So they might not even get notification of the opportunity to attend a meeting like that. Or if they do need to go to some serious type of mental health treatment, that treatment model is not designed with relatives in mind, it's designed with a traditional birth parent in mind. So those are additional challenges that we hear. And then finally, just honing in a bit more on how I mentioned that grandfamilies do have a unique protective role in the life of a young child who has been impacted by trauma. What we know from research is that there are a number of research-based protective factors that can help protect children who do experience ACEs if they have these other things in place. And the protective factors fall in a number of different categories, and there's a series of them that are called family-based protective factors. On the screen, you see on the left side of these concentric circles a description of many of the family-based protective factors. And then on the right side of the screen, you see a description of what the research shows in terms of the benefits of grandfamilies, some of which I highlighted at the beginning of this presentation. And what you can see is there is some pretty logical alignment of how the family-based protective factors line up with the benefits of grandfamilies. And so it really points to the fact that grandfamilies are uniquely suited to be reducing and mitigating the impact of trauma on children, which has a significant effect on these young people's outcomes, as was so clearly illustrated by Kenny and Chris's story. So we see, for example, family-based protective factors include a positive child-caregiver relationship and adults who model healthy relationships. And then on the right side, grandfamily benefits include a sense of safety, belonging, and feeling loved. Family-based protective factors include keeping relationships and having relationships with extended family. Those children in grandfamilies are more likely to stay connected to brothers and sisters and preserve their cultural identity, and by nature of living with a grandparent or another relative, have that connection to extended family. And then finally, a stable living environment, and we see more stability and permanency with grandfamily caregivers. And illustrative of this is a quote that comes from the grandson, adopted grandson, now son, of one of our grandfamily members from Oregon. And that's Chad Dingle, who speaks of his experience with his grandmother. Most people go to grandma's house and get spoiled, but for me, it was the only safe place I had. Getting to live with grandma was like going to grandma's house all the time. I had more love there than anywhere else in my life. And with that, I know we are going to be taking a break. We are almost exactly halfway through. So I'm going to turn it back over to Leanne to see if it's okay for us to be taking our break and come back in a few minutes.
Jaia, thank you so much. And I wanted to share with you kind of a question and also a comment. And I'll share these with you now, and you may want to address them now or loop back to them later in the presentation. And you've actually sort of addressed one, I think, to some degree. So let me just jump in. The first sort of comment and question is whether that some of the people with this particular attendee would like to know how to deal with discipline and adolescent issues, and whether or not you had some suggestions or advice regarding services as it relates to discipline and adolescent issues. So that's one. The second says that I've noticed in school settings some children have a hard time connecting with other students and testing adults in the school settings. So those are the two questions/comments.
Great, terrific questions. I have a couple of immediate thoughts, but I think what I will do is just hold those and plan to gather a little more information and respond to those after the break, if that would work.
Okay, that's fine. And then we're going to go ahead and break now. I have the 3:02. We will reconvene sharp at 3:07. Thank you.
Sounds great.
Welcome back, everyone. Jaia, if you're ready, would you like to resume the presentation?
Hi, Leanne, I'm back. Apologies.
That's fine, whenever you're ready.
Okay, I'm ready. Should I begin?
Yes, please.
Great. Thank you. So we'll start by responding to the two questions that came up before the break. And I know somebody was just concerned that they couldn't hear anything, so we just took a brief break and we're back again with the second half of the presentation. So the first question was related to resources to help with discipline and particularly around adolescent issues. And that is a very large question. So what I'm going to give in a response is really a couple of potential resources that could be helpful rather than specifically answering the question. One is that we have on our website, which I'll highlight a little bit more later in the presentation, www.grandfactsheets.org is a website that's part of grandfamilies.org that has fact sheets for every state, including Florida, across the country, with a list of programs and services to help grand families. On that, of course, is the Children's Home Network that Chris works for, which is a wonderful program that has, one-to-one supports, information, resources to help grand families in a full range of issues. So there certainly would be some resources on the Florida Grand Fact Sheet that may be helpful to connect you to help on these issues. There's also a couple of guidebooks out there that include chapters that relate to this topic, and I will highlight two of them in particular. There's one called the Kinship Parenting Toolbox, edited by Kim Fagan, Phagan, Hansel, Hansel. Really a powerful guidebook. It actually includes chapters by one of our grant members, Jan Wagner, and has a number of useful tools in it that I think would be helpful to respond to this question. And then a more recent book, and these are both available certainly through Amazon or wherever you purchase your books. And more recently, there's a book called the Grand Family Guidebook, and that is by Andrew Adesman, Adesman, and Christine Adamek, Adamec. And that book also has a number of specific tools and resources that would be helpful. So I just highlight those two. There are certainly others out there, and you're always more than welcome to take a look at our website or grandfamilies.org for a range of resources. I wanted to just offer it. I don't know if Chris Matthews has a suggestion for anything else in terms of this issue of discipline and adolescent services. If you do, Chris, feel free to jump in, and if you don't, that's okay too.
Not really. Mostly it's just life experiences, is connecting with other families at support groups and stuff, and discussing how everybody's dealing with the kids at that time. That, to me, was always a great help.
Yeah, I think that is a really important point, Chris, and it actually segues really well into the next question that we got, and that was going to be one of my key responses to that question, and that was, in school settings, what about children that are having a hard time, I think, connecting with other students and having challenges? Of course, there's some of those traditional resources at schools from a social work or a school assistance program for students, but particular to grand families, what we find is that if you're able to connect that grand family to a support group, often support groups are not only for caregivers, but have a parallel group for the children, or even just have childcare where they can be with other children and grandfamilies, and being able to connect with other children and grandfamilies really can go an incredible way to be helpful to children, particularly if they're feeling different. And also those support groups often, if they do have programs for children, they may have specific other resources in terms of mental health or other types of tools that can be helpful to those children. So those are my responses to the questions before the break. Am I okay to move on then, Leanne?
Absolutely.
Great. Okay. So we've talked a lot about the impact on the family. We're going to be moving in now to programs and policy resources and support services that can be helpful. So in the last year, there's actually been an incredible amount of progress in terms of policy opportunities to help grandfamilies at the federal level that are now trickling down to states and localities. What you have on your screen now is a picture of a wonderful grandfamily member who is at a national grand rally. We've had 5 national grand rallies on Capitol Hill, which is an opportunity to raise awareness for grandfamilies in front of federal policymakers. And we've had anywhere from 600 to 1,000 grandfamilies that come to the Hill and advocate on issues. And we've had a great deal of policy success as a result of that and other activities that we've been a part of and have worked on with other national leaders. I want to highlight 3 pieces of legislation that we worked on and are now actually federal law. The first is the Family First Prevention Services Act, which is a major child welfare bill I'll talk about in a minute. The second is some new Kinship Navigator Program funds, which actually 46 states, including Florida, applied for and received 28 funds, and now there will be additional money made available in 2019. And then finally, the Supporting Grandparents Raising Grandchildren Act. So the Family First Act, for short, or FFPSA, is a major child welfare law that really had a couple of key themes. One is it focused on the belief that preventing children from entering foster care or for the need to enter foster care is really important. And while previously the majority of federal dollars went to children went to help children only after they came into the foster care system, there is really a need to provide support for prevention. So it used to be that for every $1 or every $7 used to help children that come to the attention of the child welfare system, only one of those dollars could be used for prevention. This legislation turns that on its head and really provides an opportunity for states to use prevention dollars. Now, Florida is in a little bit of a unique situation because the state has had a waiver that has allowed more flexibility, but those waivers are slated to go away beginning in 2019 in many states, and so there's a need to really be looking at how federal dollars are used to be able to provide prevention services to families through the Title IV-E funding stream, which is the primary federal route for funding child welfare services. The law also believes, based on the fundamental belief that children do best in families versus group care, and so it actually reduces over-reliance on group care or congregate care by reducing funding, federal funding for those programs in exchange for supporting those prevention and prioritizing family for children. So congregate care can still be supported by federal dollars, but it must be short-term, meet certain high-quality standards, and be treatment-oriented. And then finally, it has a significant focus on investing in evidence-based programs. So for the federal dollars to support them, they need to meet certain evidence bases. In particular, the Family First Act has this opportunity to provide prevention services, including prevention services to children in kinship care, and the prevention can go to the kinship caregivers, the children, and the birth parents, and can serve all 3 of those at once. The types of services include substance use prevention and treatment, mental health services, and in-home parent skill-based services. Now, states have the option to use this federal funding stream in this way. They don't have to. There is a state-federal match, so the federal government doesn't pay the whole amount, but it pays a significant amount. And this funding can become available to states that opt to do it beginning October 1st of next year. The services that are provided need to be evidence-based, and so what is an evidence-based service? The federal government is actually in the process of putting together, they've identified a group to do a clearinghouse, and they're in the process of putting out an initial list of what qualifies as evidence-based services, and then there'll be a process for approving state programs as evidence-based as states elevate the intention to use those programs. And those services are available with federal reimbursement for 12 months at a time for children, caregivers, and parents of children who are at imminent risk of entering foster care. And that term imminent risk actually will not be defined by the federal government, so that is actually left to states to identify. In addition to that, the Family First Act, as I mentioned, does reduce over-reliance on group care by providing less federal dollars for that. However, the group care that it will continue to support must meet certain quality standards, and part of those quality standards is encouraging the engagement of family members in treatment and planning for children and making decisions about whether or not group care is appropriate for a child that is with kin. It also does a number of things to improve licensing standards for placement with relatives. So I mentioned that a small percentage of children in grandfamilies are actually in foster care with relatives. Part of the reason is that there are a number of barriers to licensing relatives as foster parents. We found that licensing standards in many cases were created not with relatives in mind, so they face a number of barriers to licensure, and that includes things like requiring a separate bedroom for each child, or requiring a certain amount of square footage, or we really find that those standards were created often in a reactive way. Let's say that a child was bitten by a particular breed of dog, and then the state creates a requirement that there can't be any Rottweilers in a foster parent's home. So we see that those kind of standards have really created barriers to licensing relatives over the years. And so the law actually requires that HHS, the federal government, identify model standards, and that states should be measuring their standards against those model standards with a particular eye towards addressing any barriers to licensing relatives. The federal government did put out proposed model licensing standards with an eye towards this issue in August, and there was a period of public comment. And those standards were based in significant part on a package of licensing standards that Generations United worked on in partnership with the American Bar Association, Annie E. Casey Foundation, and NARA, which is the National Association for Regulatory Administration. And this piece on your screen highlights the availability of this standards package. And so if states are really looking to get a jump on adapting their standards, what we have seen is the proposed standards, while they aren't as detailed as these standards, there's nothing that conflicts with them, and they really were based in significant part on these standards. So this is a great resource tool for states if you're looking at updating your licensing standards to be able to license more relatives. In addition to that, the Family First Act will actually provide up to 50% reimbursement for creating kinship navigator programs, which are information and referral programs for kinship families that can also be surrounded by a number of additional wraparound services to help the families. And those can serve children both inside or outside of the system, and the children do not need to be at imminent risk of entering care. It's really all kinship families, whether or not they've come to the attention of the child welfare system. However, the Family First Act only provides financial reimbursement for evidence-based kinship navigator programs, and we know that many parts of the country don't have any kinship navigator programs, so to get it up to the point of an evidence base right out of the gate is challenging. So we were able to successfully advocate for some dollars to go out to states, territories, and tribes operating Title IV-E programs to really start developing those programs to get them up to the evidence base. So this money can be used to develop a new program, to enhance an existing program to get it up to a quality standard, or to evaluate a program to be able to prove that it is an evidence-based program. So there's a lot of flexibility in that way with those dollars, but they really are specifically to develop a kinship navigator program. And it points to a federal law that lays out some specific components of a kinship navigator program. Can't go into all of those right now, but do want to highlight that we will be holding another webinar. Generations United will be holding a webinar that specifically looks at what a quality kinship navigator program looks like next week. And that webinar will feature the Children's Home Network, which offers a quality kinship navigator program, and information about those opportunities is available at our website at www.gu.org, or you're welcome to email me about it. At the end of this session, you'll get my contact information. So there is dollars that are available to states, including Florida now, to create kinship navigator programs, and there should be a second set of dollars to continue that work in 2019, applications to come. Whoops. Sorry, hold on a second. Okay. Nope. Sorry, I lost my place here. Okay. There we go. So what do we know about kinship navigator programs? A couple of things. We know there's a lot of programs across the country right now, but they're not in every state. We did a quick preliminary look and found that there were about 70 programs across the country, but in some cases there may be 25 in one particular state for different parts of the region. So we do have a list of the programs that we're aware of. They're not all evidence-based, certainly, but programs that we're aware of across the country. If you want to take a look, they're here. We know that generally it's better not to house kinship navigator programs at the Child Welfare Agency, in particular because of trust issues. Often grandfamilies may not be comfortable going to the Child Welfare Agency, whether or not they have a pre-existing relationship with the agency. There are often issues of trust and concern with the Child Welfare Agency. And also, many of them have never come to the attention of the Child Welfare Agency, so it's not a natural place that they think of going to. They don't connect themselves with the child welfare system, so it's not always the best place. There are some successful programs that are housed at the Child Welfare Agency, but generally, as a rule of thumb, that's not our recommendation. We've seen particularly successful models that have gone through community-based organizations, so would love to see states and localities contracting with those programs that are already familiar with serving grandfamilies, including those outside of the system. We also know that successful programs have a combination of peer-to-peer relationships and professionals doing the work. So there's actually research that shows that kinship navigators that are grandfamilies themselves that have been there and been through it are more effective at connecting other grandfamilies to benefits and supports and services than degreed professionals. However, if you have really complex clinical issues that the family is facing, that it's really important then to have that degreed professional involved to help address those complex issues. So a combination of the two is particularly helpful. We also know that it really needs to be more than just a phone line and certainly more than a website. But those can be complementary pieces, but there needs to be information and referral, but also a combination of other supportive services, and we'll talk about effective models soon. And finally, just over the summer, the Supporting Grandparents Raising Grandchildren Act of 2018 was signed into law, and that act establishes an advisory council through the Department of Health and Human Services. It's actually going to be run out of the Administration for Community Living, which houses the Administration on Aging. And that council will consist of a number of federal agencies that impact grandfamilies, and it's also calling for nominations for grandfamily caregivers themselves to serve on the task force, and nominations for that opportunity are due on Monday. So we look forward to seeing who ends up serving on that task force. which will do work to better coordinate federal resources to support Grandfamilies, and will be issuing ultimately a report on best practices and gaps in services that will be then sent on to Congress. Just 2 words about kinship legislation in Florida. There are some recently passed pieces of legislation this year in Florida. One is focused on promoting the use of kinship navigation services in the state. And then a second one actually does a pilot program and looks at, authorizes a guardianship assistance program beginning in July of 2018. A word about what a guardianship assistance program is. That is a program that allows relatives who have been licensed foster parents to then actually get guardianship of the child. So when you're a foster parent, of course, the legal custody of the child is with the state. But if the relative would get guardianship of the child without a guardianship assistance program, they would lose that foster care payment. What a guardianship assistance program allows is that the foster care payment continues and gets to go to that relative, but they would get legal custody of the child. And this is particularly important for those Grandfamilies where adoption may not be the best option, because we know adopting out of foster care comes with adoption assistance, but particularly for relative caregiver families, guardianship might be better because the child may not want the parental rights of their birth parent to be terminated. They may know that the relative is permanently going to be their primary caregiver, but may not want to be calling them mom and dad, may still want mom and dad to be part of their life, even if grandma and grandpa is permanently the primary caregiver of that child. So take a look at those 2 pieces of legislation in Florida. So now we are going to turn over to digging in a little more deeply on what supports and services have been shown to be really beneficial to Grandfamilies. But to frame that out, I'm going to turn it over to Diane Rosnowski to really put another face on what it's like to be a Grandfamily and to talk about her experience and how it points to the need for supportive services. So such a privilege to have Diane with us. I'll say that Diane joined our staff over the summer and comes to us with a wealth of knowledge and background from her professional experience before coming to Generations United, but also comes with personal connection to the issue as well, which I so value. So, Diane.
Thanks, Jaia. So growing up, my family was always just the 3 of us, my mom, my older sister Emily, and me. From the time we were 4 and 5 years old, our mom was our only parent. She juggled the demands of her career as an attorney with raising us. It wasn't always easy, but she made sure Emily and I were able to do the activities we wanted to. She did what she could, and it paid off. We were national champion athletes and honor students. Shortly after I turned 17, our family changed forever. Emily had moved out and was living with a friend. One day, she randomly got coffee with our mom and told her that she was addicted to heroin and needed help. The next 3 years consisted of Emily going in and out of detox, rehab, intensive outpatient treatments, jails, and sober living homes. Our family's life was defined by chaos and never knowing what was coming next. During one period of using, Emily learned she was 22 weeks pregnant. Her doctor told her that if she stopped using, her child could die. Emily spent 12 hours a day for 2 weeks looking for somewhere to receive treatment. Finally, and with the help of a state senator, she found an outpatient medication-assisted treatment center. And on February 27, 2016, she gave birth to a healthy baby girl, my niece Carter. Emily had never babysat or even been around small kids, but being a mom came naturally to her. And for the first time in 4 years, we thought that she would make it to the other side. On December 3rd, 2016, our worst fears came true. On her way into work, Emily bought what she thought was heroin, but the packet she used ended up being pure fentanyl. It killed her instantly. She was 22 years old and left behind a 9-month-old. When Emily died, she and Carter had been living with my mom, and due to Carter's dad's abuse, he had only had supervised visits. My mom and I kept taking care of Carter informally throughout Emily's funeral. But one day my mom realized no one could legally take Carter to the doctor since Emily had sole legal custody. She filed and was granted a motion to intervene in the custody case between Emily and Carter's dad, and she was granted it. When my sister died, our mom had been a family law attorney for over 35 years, where she regularly helped grandparents raising their grandchildren. But when she became the caregiver, she had no idea where to turn for help. She eventually went to apply for Social Security survivor benefits for Carter and was immediately told that Carter's dad had already applied for them. She was able to get his application stopped after giving the office a copy of the new custody order, but it took much longer than it should have to receive the benefits. Before Emily died, Carter wasn't in daycare because Emily had worked nights, so she and my mom would switch off who was watching Carter. My mom needed to go back to work, which meant she needed to find a daycare for Carter. We found a daycare that would work with the daycare subsidies in our area, but found out my mom didn't qualify for one. So she had to start paying for daycare on top of already paying my college tuition. My mom was dealing with the emotional shock of losing her daughter and having to start raising a baby again while trying to deal with the financial burdens that came with both. When she found a place to go for help, the offices were as helpful as they could be, but they didn't know which other services she could have applied to. When my sister was ready to seek treatment for her substance use disorder, we could always go to our county's drug and alcohol office for help. It would have been nice to have one office to go to for help getting support for her daughter when she died. Personally, I've had to deal with losing my older sister and knowing that one day I will most likely have to become Carter's caregiver if something happens to my mom or if she just can't do it any longer. Being able to care for my niece is something I want to do, but I worry that we aren't supporting relative caregivers enough. We need to have kinship navigators that help families like mine. We need to help with child care costs, and we need to expand access to treatment to reduce the number of families that end up like this in the first place.
Thank you so much, Diane. An incredibly powerful story. And I really want to thank Diane for being brave enough to share this story while also being an employee of Generations United, so thank you for that. I think this story speaks so powerfully to the impact of stepping into this role unexpectedly and the impact it has on every member of the Grand family. So often I think we think about the caregiver, the child, and the birth parent, and I think Diane speaks to the fact that other family members are also impacted by it. So thank you again. I'm going to talk a little bit more about types of help and supportive services that can be beneficial to family members. But I think I want to reflect back on the piece that Diane shared about how her mother was a family law attorney and had been helping grand families for years, but when it came to it being in her lap, it was overwhelming and she still didn't know where to start. And we recently actually, I recently connected with one of our grand members who attended a major convening that Casey Family Programs, a major child welfare funder, pulled together with a number of leaders, social workers across the country, leaders of child welfare systems, and she came there as the kinship voice, spoke on a panel about what it means to be a grand family caregiver, and she also works for a kinship program. And she said that after she gave her presentation, she was actually approached by a social worker who had a question. And she assumed that the social worker was going to ask a question about a family that she works with or get some insight into her experience. And she said that social worker actually broke down crying because she said, I've been working with kinship families for years, but now I am a caregiver and I don't know where to start. I've been helping these families for decades, and now that it's fallen in my lap, I don't know where to start. So it really speaks to just what an incredible thing it is for life to be changed in this way. So with that context, what kind of supports and services are helpful to families? We've talked a good amount about kinship navigator programs, and really what those are is a one initial portal place to go that families can get information about what is out there in their community that can help them really to do a full assessment about what they need and connect them to services. There's also a need for financial supports. As we've said so many times, that relatives step into this role unexpectedly, and while as a country we recognize that when non-related foster parents are stepping in to take care of other children, we need to provide them with board payments and support to care for the children's needs, foster parents also have time to plan for it financially, to make a decision to step into this role, whereas relatives have no time to plan, often getting this a child at their doorstep in the middle of the night. But for some reason, we've created, in many cases, a two-tiered system where we're willing to pay unrelated individuals and license them as foster parents, where we don't take that step for relatives and assume simply because you're related to the child, some sort of magic will happen and you'll be able to find the resources to care for the child. It just is not the reality, and there needs to be a way to provide better financial support for relatives. We also find the need for more physical and mental health services, and whether that's providing quality services to them or even addressing issues related to legal authority to access those services on behalf of the child. Substance use services are important for prevention services for the young people, but also many of the substance use services that are out there are designed specifically to work with the birth parent or the individual that is struggling with a substance use disorder, but doesn't provide information to the caregiver who's taking care of the child. They may even be okay at working with the child too, but the grandfamily is often left out of that loop in terms of what does it mean, what are behaviors that you might see with somebody with a substance disorder, how do I understand that, what does trauma mean? We also see support groups are incredibly helpful. Chris spoke about how valuable a support group has been. I can't tell you how many of our grand members and different grand families that I've talked to over the years that have actually said, this support group literally saved my life. I've heard that on many occasions. So connecting with others that have information and that can just relate to the experience that they've had is really important. Respite care is really critical, having a break so that families can take a nap, can go out with a friend, or maybe just sit in a chair and have an opportunity to do some deep breathing or go to the grocery store. Having a break from that full-time caregiving responsibility of a child that may have significant issues because of the trauma in their past is really significant. And tied with that, I will put child care, is that so often child care is a huge barrier and a huge financial impact on grand families. Housing, I mentioned before, Chris spoke to, there are really some innovative housing services programs out there. There are a handful of programs across the country that have housing specifically designed for grand families. They just over the summer opened up a new housing complex like that here in D.C. There's a model program in New York, South Bronx, one in Baton Rouge, Louisiana, Missouri, among others. We have them listed at grandfamilies.org, and those programs have services on site to help grand families, the children and the caregivers. And then finally, legal services, helping the caregiver access information to apply for guardianship of the child or make decisions about what to do in terms of legal authority issues in a way that's affordable. So some of the key services. Also want to point to this tool that we created with a number of other national leaders. We did some interviews with leading child welfare agencies across the country, agencies that we found had really high numbers of children in kinship care or had seen significant jumps in the number of children that were in kinship care within a short period of time, and said what were the common trends that we found across programs, child welfare programs, that were doing well in terms of having a kin-first child welfare system. And we found these 7 factors that we really looked to programs that had leaders that prioritize kinship care. So if you have a strong leader that says kinship care matters to us, we're going to do what we can to address barriers to placing children with relatives and make sure that children are with relatives when there's a relative that they can safely be placed with. Of course, then those those plans and that approach needs to be written in policy so that it becomes a fundamental part of the way that operations happen. We also found that they need to be identifying and engaging kin at every step, including the very beginning. And even if a relative can't step forward to be a full-time caregiver, they may be able to provide support to the child or the family in another way. And we really need to create a sense of urgency for making kin placement the first placement, because we know that when a child isn't with kin in the beginning and they go with a non-relative, that their chance of reconnecting with a relative goes down, and also even that short period of time with a non-relative versus someone who's familiar with them actually contributes more to the trauma that they've already experienced. Also, making licensing kin a priority. I spoke a little bit about licensing in the Family First context is really important, because when you fully license a kin, that means that they are going to get access to the full financial support that comes with being a licensed foster parent and the other supports and services. Providing support to permanent families, that speaks to the post-permanency services, that families' needs don't stop after they become permanent guardians or adopt a child, so we need to have more services post-permanency. And then for those grandfamilies that are raising children outside of the system, we need to be creating strong community support network for those families that aren't relying on the child welfare system for their support and connection. So I'm going to speak in the last 10 minutes or so about a few programs that are out there that we have evidence, in some cases have clear evidence base behind them, and have really risen to the top for that reason, and then others that we just really have seen anecdotally incredible outcomes with. I've mentioned the Children's Home Network, based primarily in Tampa, has a Kinship Navigator program. This is the program that Chris works for, and that has a number of unique features. I will highlight that their Navigator program is on its way to being evidence-based. While we can't absolutely confirm it yet, we do fully expect that it will be named as one of the evidence-based programs when HHS releases their list. Their Navigator uses actually a 1E application, so they actually go out to homes of kin families to do an initial assessment and bring iPads out to help them apply for different benefits. They also use a peer-to-peer support model. I mentioned how the kin navigators, when other kin are helping kin, that they're actually more effective at help connecting them to services. That's been proven in this Florida model. But they also engage an interdisciplinary team at taking a look at different cases and getting the full range of perspectives from degreed professionals in terms of what supports and services would be helpful to a family. They do use a variety of standardized assessments to help address the family's needs, so there's some great tools out there available from them. And then they incorporate a wraparound model and a family-driven approach that partners with key community members. So I know Chris is involved in reaching out to the community to make those connections between community services and the program. And it's really important that this is not just an information and referral service, but that the program surrounds families with a range of other support groups and other services to help the families. There is some data that's come out of this program that looks at the reasons that children are in grandfamilies that come to receive the services from the program, and you'll see that drugs and alcohol ranks among the highest of the reasons that those families come to the attention of the program. The program is evidence-based, is working on getting that official approval from the different clearinghouses, but a 5-year evaluation of the program shows that looked at all 3,000 participants in that particular study, showed that they had extremely low rates of re-entry into the child welfare system. 99% of participants did not enter the child welfare system again at a 12-month follow-up, so they had real stability and clear child safety. And in addition to that, there were huge cost savings from this program. When you look at the cost of this program and compare it to placing children in foster care and non-relative foster care, that the non-relative foster care is 6 times more expensive and group care is actually 21 times more expensive than this program model. So If you're interested in learning more about this program, I know that there is interest in making this program available in different parts of Florida. I'd be happy to connect you with the lead person there, Larry Cooper, who leads the kinship program at Children's Home. I'm going to just see if Chris has anything else that you want to say about that program, or if I covered the highlights, if you're still there, Chris.
Yeah, I'm still here. You basically got most of the highlights. Yeah, I can't think of anything you left out. You did a great job.
Great, thank you, and thanks for the great work you do with that program, Chris. Great. A couple more programs we'll highlight. One is the Grandfamilies program through the Children's Services Society in Salt Lake City, Utah. So you have their contact information here on the screen. So this program, I think why I particularly highlighted it is they do have a couple of components of it that really, in particular, look at substance use. Here's a snapshot of their screen, and I'll say that these slides have links to the program, so you can actually click on the slide and link to each of these programs as I'm speaking about them. They have a Grandfamilies support group that is a 10-week series of classes, and among the topics discussed is understanding drug and alcohol addiction, legal rights, and emotional issues of children. After participants finish that class, they have an opportunity to participate in follow-up activities that are described here on the screen, but they're really asked to first start that class, and then that opens up this range of other activities available to them. And they, as I mentioned, often support groups come with children's groups, so this program also offers children's groups and connection to other supports and services to help the children. Excuse me. And then they have an advocacy and crisis intervention component as well, and information about how to access other services in the community. Next, I'll highlight a program out of Las Vegas, Nevada. It's called Foster Kinship, with information also on the screen. There's three major components to this program. They have what they call their Kinship Navigator. There's also a training series that I'll talk about in more detail. And then in addition to their full Navigator program, they actually have an online website with information to just access resources locally if somebody's only comfortable doing it online. That's available, and each of these services also has an online chat box for folks that want to communicate with somebody from the program that way. A little bit more about their Navigator program. The way that this program operates is they have a Monday, they have set kinship center hours where folks can drop in, although they recommend appointments, and then they have a whole series of different services that they provide to those that come in person, range from help accessing TANF to support groups to information about family events, etc. You can also receive services directly just through the phone if that's the preference. In terms of the training component, they have what's kind of similar to a Kinship 101, an initial kinship information session that they have once a month in 2 different locations in person. And then you'll see at the bottom of the screen they also have a quick video that is essentially the orientation online if folks can only access it that way or prefer to access it that way. In addition to that, they have a kinship roadmap that helps give a sense of the different paths that kinship experience can take. And then they are also the provider of kinship licensing training for those that are seeking to become licensed kinship parents. And so they provide the training, but they also really help the kin through that process, because so often kin come up against barriers to becoming licensed, and they found that the child welfare systems are not always helpful at taking the extra steps to help get them over those barriers, and so this program helps address that as well. So that's the Nevada program. And then I'm going to turn it over to Diane, who has been recently exploring a cool program called Camp Mariposa to highlight what that program's about.
Thanks. So Camp Mariposa is a national addiction prevention and mentoring program run by ILUNA and local partners. It's designed for children ages 9 through 12 who have a family member, most often a parent with a substance use disorder. Approximately 40% of the youth who participate in the program have lived in foster or kinship care, and almost 20% currently have a grandparent as their primary caregiver. The program offers no-cost weekend camps that are held 4 to 6 times throughout the year. And once campers age out of the program, they're able to come back as an older mentor for the younger kids. During the weekend camps, the kids get to participate in traditional camp activities like canoeing and ropes courses, but they also get educational and support exercises that are led by mental health professionals. In addition to the weekend camps, they offer additional activities throughout the year meant for the entire family. They currently have 13 locations, including 2 in Florida in St. Petersburg and Sarasota, but in 2017, they served 713 children nationally. This camp is a safe place for children impacted by substance use disorders to have fun and get the support they need, and the program has demonstrated results. In the first half of 2018, 94% of campers and the junior counselors had not used drugs to get high, while 98% of them had no involvement with the juvenile justice program. Additionally, the campers really appreciate what they get there. One camper named Isabella said that Camp Mariposa helps me get away from all the things that are going on in my life. When I come to camp, all of the stress goes away and I get to let loose and have fun. I come to camp and find family and friends who I know will be there for me whenever I'm down. Camp Mariposa is a home to me and I love it here.
Awesome. Thank you so much, Diane. So really cool models that have been proven to be successful for kin. So again, each of these is linked if you want more information at their website. So next we have just a few minutes left, and I do want to have a chance to respond to questions. So real quickly go through resources. This is Generations United's website. I talked more about us at the beginning, but feel free to go here for more information about what we have to offer. In particular, I direct you to the Explore Our Topics tab, and then click over on Grandfamilies for information specific to Grandfamilies, since our organization does do more than just work on Grandfamilies. I also mentioned grandfactsheets.org, which is housed at grandfamilies.org. This is where most of our Grandfamilies content from Generations United is held. We do this website in partnership with the American Bar Association and Casey Family Programs. This has state-specific information on issues affecting grandfamilies. You can do a search by state law at that tab. We also have resources and different publications, but we really track actually state legislation and laws and statutes that impact kinship in 10 different topic areas. So encourage you to take a look at that. I mentioned the state fact sheets housed at that website. They are updated generally about annually, but we do our best. It's somewhat a reactive update, so if you have information that's not on the Florida fact sheet, we encourage you to send it to us, and we will do our best to update that and add a program that's relevant to help grandfamilies. We hope it's a resource to you. Here's some other of our publications that are available. 2 issue briefs, one that focuses on how states address the issue of providing TANF to families and suggests ways to improve access to TANF, and another that looks at this issue of educational and healthcare consent for those families that don't actually have legal custody but are looking for approaches to be able to get access to education and healthcare for their children. There's also a piece that specifically looks at the Guardianship Assistance Program. I think this will be a really helpful piece to Florida with the new legislation where you're looking at implementing a new GAP Guardianship Assistance Program in the summer of 2019. So this looks at how other states are doing it, what they're doing to make it work in their state. We have a publication on for grandfamilies raising children with disabilities that is really a guide on this topic that is one of our more popular resources to grandfamilies. A fact sheet that helps grandfamilies know about what key questions to ask when applying for TANF for the children in their care. And then I've highlighted 2 of our State of Grandfamilies reports. This year's State of Grandfamilies report is called Love Without Borders, Grandfamilies at Immigration, and it looks particularly at the the additional challenges that grandfamilies raising children where there is a family member who is an immigrant face. And it really looks at that issue of children being separated at the border among other types of immigrant grandfamilies and the additional challenges and opportunities that we have to better serve those families. Also coming soon, by the end of this year for distribution in early 2019, we are creating a set of tip sheets for families who are raising children because of substance use. They'll be on these particular 5 topics, so please stay tuned to our website for those resources. I've also highlighted a couple of other national organizations that do good work in the grandfamilies and kinship space. So those resources are available at your screen, and then some other key substance use and trauma resources as well. And finally, in closing, I want to just talk about why, again, it's so important that we're supporting grandfamilies. I find this particularly helpful and inspirational when we talk to caregivers themselves, that we know that the role that grandfamilies play in the lives of children and young people are important. And being a protective factor and being such a key role in the life of a young person really does make a difference. And you never know what that grandfamily may be doing in the life of a child. It may be that that young person will grow up to be Simone Biles, who was raised by her grandparents and is, of course, an Olympic athlete and gold medalist. It may be that they'll grow up to be a comedian, and for those that might not recognize this picture, since these are the only public use pictures I could find, they may be Carol Burnett, who is a comedian who was raised by her grandparents, and actually at the end of her program used to pull on her ear in memory of her grandmother, who she so valued, who raised her. They may grow up to be the President of the United States. Picture here of Barack Obama, who was raised in significant part by his grandparents, who he's with here on a park bench. There are so many examples of grand successes. Here's just a few, from celebrities to our current Assistant Secretary at the Administration for Community Living, to Senator General Wesley Clark, among other leaders and famous individuals. Grandfamilies are important. Today, people are so disconnected that they feel they are blades of grass. But when they know who their grandparents and great-grandparents were, they become trees. They have roots. They can no longer be mowed down. This comes from Maya Angelou, who herself was a member of a grandfamily. And with that, here's my contact information. Please do feel free to contact me if you had a follow-up question or something that you weren't able to reach out to on this session. And then I need to share links to references for the different resources that were highlighted in this presentation. And I will stop there and turn it back over to you, Leanne.
Jaia, thank you so much for this wonderful presentation, and also, of course, to all of the members of our presenting team who spoke today, and all the rich stories and the valuable resources. There's just a lot here for our attendees to dig through and get more information from. So that's going to be great. So I will go ahead, if you're ready. I'll take control back of the presentation.
Sounds great.
And we'll begin just to run through some concluding remarks and some wrap-up. So do be reminded, everyone who is listening, when I conclude today's webinar, your browser is going to take you to an evaluation form on FATA's website. And if you want to receive continuing education credits or a statement of credit for this event, do please complete that evaluation for us before the deadline. When you get prompted to the website, you are going to be you're going to be prompted to register or to sign in to complete the evaluation, and you can certainly register as a visitor at no cost. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, do provide us with an accurate Florida Department of Health license prefix and number at least the first time that you register with us. And then after you register or sign in, you'll be directed onward to the evaluation. You may consider using the same email address when you register for webinars through our WebEx link and when you set up your profile in FADA's online community. And this helps us connect your attendance with your profile. Do be aware that we do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your own profile. You will get a second opportunity to complete the evaluation if it's not convenient for you to complete it right away. This will come through a follow-up email later today in about 30 minutes. The sender will be FADA On Demand Messenger at WebEx. Do be reminded that the evaluation will close at midnight on Monday, December the 3rd. And I'd like to thank Generations United and JBS International for their work related to this training today. And would like to recognize especially the Florida Department of Children and Families, Office of Substance Abuse and Mental Health for funding today's education. And then finally, thanks to all of you for attending and participating in today's webinar. So have a great rest of your day, and please hold now for the evaluation. Thank you.